Good afternoon, everyone. Welcome to Navigating the New Realities of Care Delivery with TELUS PS Suite webinar. My name is Teresa and I am the Implementation Director here at TELUS Health. I've been with the organization for a little bit over 20 years now. I've supported a number of different teams through learning, project management, as well as our data team. And we are working with you as our newest clients to help you in the implementation of your system in practice. So we're delighted to have you with us today, and we hope that you will enjoy this presentation. Before we get started, we just want to cover a few housekeeping items. To ensure better sound quality, we recommend that you connect to the webinar with the telephone number that was provided to you in the registration confirmation. We also ask that you ask questions directly to the speaker at the end of the webinar, or you can use the chat function. Your audio is muted by default. The webinar is recorded, and a link of the webinar recording will be sent to you in the next few days. Your feedback is important to us. It helps us improve our webinars and address topics that are important to you, such as we invite you to complete a short satisfaction survey that will appear after the webinar. By completing the survey, you will be entered in our draw to win a $300 Amazon gift card. And please know that your responses are confidential, and we ask you fill in the contact card at the end of the survey to be eligible. You may have noticed that our webcams are activated. To change the location of your webcam, hover your mouse over the square icon in the top right corner of your screen, which is currently presented. You'll be presented with three options. We recommend clicking on the side-by-side option for optimal webinar viewing. If you have a question during the webinar, please post it to the Q&A tool. You can access it from the three-dotted icon located at the bottom of your screen. Type your question, select to all panelists, and press submit. We'll try to respond to these questions at the end of our presentation period. At that time, the audio will be open for you to ask questions live. Please note that we'll also be opening the phone lines at the conclusion of the presentation to provide an opportunity to ask questions live. Now let's have a look at today's agenda. My colleague, Alison Foster, will do a live demonstration of PS Suite so you can see how the solution can help you become more efficient, flexible, and responsive so that you can have more time to focus on your patients. The webinar will focus on how PS Suite EMR, communication with patients, pharmacists, and other providers, accessing your EMR from your mobile device, and our implementation process, followed with the question period. We'll also discuss, we'll move on. Alison, without further ado, I'll turn it over to you.
Yeah, so thank you, Teresa. So as she mentioned, I am Alison, so I'll be walking you through the PS Suite demo today. A little bit about myself. I've been with TELUS for 5-6 years now in a variety of different roles. The common theme of those roles has always been working with the product to find custom solutions, more efficient workflows, or helping you navigate kind of your EMR within your clinic to more efficiently. So just to kind of set the tone for today. So the current pandemic has turned virtual care into a daily reality. So it's changed the way we're delivering healthcare. So that meant obviously changing a lot of our current practices we have within our clinics. So what we quickly realized is to be used efficiently, remote healthcare must be integrated into your current workflows. So we worked really hard to mimic what workflows you've already established inside of your clinics and kind of integrate these tools directly into your existing processes. So we know that success meant less change management, kind of easy to adopt, just so we can provide more remote meaningful encounters with your patients, again, during the pandemic and probably beyond the pandemic. So the new reality is we have to incorporate these tools into our current processes and hopefully improve them as we move forward and grow your EMR use. So my goal today is to show you how PS Suite can use tools like virtual visits, as Teresa mentioned, communicating with providers, communicating with pharmacists, with your patients as well in a remote virtual care world. So I'm going to, again, spend the majority of my time inside PS Suite. So how I'm going to do this, I'm going to get you situated with some important screens like the appointment schedule and like the record window. But then I'm going to actually use Teresa to do a mock encounter. So she's going to be my patient. I'm going to walk you through how we, again, would deliver that remote care using our EMR. So I'm actually going to get right into the PS Suite overview. I know we have a little bit of a quick time together, so I want to make sure you maximize the time you see PS Suite. So PS Suite, again, is launched directly from your desktop. So it is an icon that's easy to launch on your computer. And what it will do is open up what we call our main toolbar. And this main toolbar is how we navigate through the different areas of the program. So things like your appointment schedule, things like your patient demographics, your billing files, your address book, which is your external communications, providers or pharmacies or diagnostic imaging centers. We have our handouts, which is a repository or storage spot, our messages, which is our kind of like our task list, our to-do list for internal and external sources. So we'll cover that a little bit later on. And finally, our records window. So the different modules of PS Suite, they're always interconnected. So again, to get from your records window back to your patient file or your appointment schedule, it's always a quick click or a shortcut away from your keyboard. So one of our main focus, or our biggest focus we have with PS Suite is to make sure it's easy to use and easy to navigate. So again, another way that we kind of promote that use is we can do multiple screens at once. So if we open up our patient file, we open up our appointment schedule, you can see that there's, again, cascade on top of each other. I can resize the windows, I can go back and forth. I can still view all of these items from different screens. So it's fairly rare to go back into the main toolbar to navigate around. Again, most of the time we're using links within these screens to get the information we need at that point. So I'll go back to the main toolbar just for one more second. There's one thing I want to point out. Our second kind of priority is with PS Suite is we want to make this configurable for each user or each role. So while our main toolbar is, again, standard across all of users, we have a configurable dashboard that can be customized per user. So that'll be a common theme you'll see with me today is that everything you see, whether it's your record window, your appointment schedule, your patient file, it can always be customized for your clinic. So that's why we've been so successful in kind of adopting PS Suite into a number of different scenarios is because we can, again, customize our program to suit your needs. So just to kind of walk you through an example, I'm logged in as a physician, Dr. Foster right now, so I might want to see my unopened labs here, whereas somebody who's logged in as an administrator, they might not care about labs, they might care about coverage within their clinic. So see who's on vacation, see who's covering for who's out of office. So they can always customize this main toolbar, again, to suit your needs as a particular user. So customization is, again, a big central point of our EMR as well as ease of use. So to highlight, again, I did say I'd start off with a quick tour of the screens you'll be seeing today. I'm going to start off with the appointment schedule. So the appointment schedule, I'm going to make that full screen. We can see a little bit better. Right now, I'm looking at one particular provider. So I'm looking at Dr. Foster's schedule. And I can, again, with a quick click or a quick keyboard shortcut, change that view to day, weeks, or months, or see particular days of the week. So just to highlight how easy our program is to navigate, if I put W and press enter, there's my week view. So if we look at our week view, we have background colors, we have different icons we can use, we have different colors for reasons for visit as well. So this is all can be customized per site. And again, that's part of your training is how you can customize this appointment schedule for your needs. Going back to navigation, if I put, again, 3W in that action bar, press enter, I'm 3 weeks ahead for my next follow-up visit. So 6M for 6 months, I can quickly navigate around to the different views with quick keyboard shortcuts. If you prefer calendars, again, I'm not going to spend too much time on navigation, just to kind of highlight some key points. We also have a simple calendar to help you navigate around. So we always have a keyboard shortcut. We always give you easy ways to navigate through with your mouse as well. So again, you're one click away from getting the information you need on your screen. Let's go back to today's date. So in terms of booking appointments, I'm going to double click and I'm going to write in my patient's name. I'm going to use this particular patient to give you a tour of the record. So here's my, again, drop down for different appointment types. I can change the background color, change the length of time. If I want to make this a virtual visit, I simply turn on virtual visit right here, and that's going to initiate, again, this visit to be conducted remotely. So here's an example of how we want to embed current workflows, virtual tools into current workflows. So an example of this is nothing has changed with the booking process. We just added a quick click to make that a virtual visit connected through the EMR virtual visit solution. And I'll come back here and show you how to conduct these as well. That's kind of how you book the appointment. Double click, put your patient's name in, indicate if it's in the clinic or virtual. And I'm going to jump right into their record by going with the right click or keyboard shortcut into their EMR screen. So I'm going to spend maybe 3 minutes talking about the overview before we jump into the patient encounter with Teresa. So think of the PS Suite record as a holistic view of the current status of the patient. So it's kind of 3 different portions. The first portion is we have their demographics, including their picture. We can see their next appointment visit or next appointment date as well. This is always going to be visible for you, or you can hide it if you don't choose to, if you don't want to see that on your screen. The second portion is our CPP, or our patient profile. So family history, our problem list, our current medications is right here. Same idea, you can always move this around to suit your needs if you want a different view to your record window. And here's the part that gives you the best view of the patient. So everything you see in this spot down here gives you a current snapshot of the issues. So when you open your record, you see the most recent information. So if it's an x-ray, if it's a picture of the rheumatoid arthritis of the hand, if it's what medications have been started, everything is kind of at a glance. So if you had a social worker do a screening for you, you'd see that social worker's notes as soon as you open the record. For navigation purposes, to get this out of the way, we have a table of contents. We have different view filters. So I want to just see my imaging reports. I just want to see my tests. Just want to see my prescriptions. We always have built-in filters to further kind of customize this view of the progress note area, or the entries into the record. So everything's right in front of you. There's no different screens to look at. It's just kind of using our built-in filters to find the information you need. The last part of the record is what you see here, these kind of 2 little bars. We call these toolbars in PS Suite. This is one of the ways you can really customize your EMR. So it can be quick clicks to your most commonly utilized tools for a specific role, for a specific user even. Maybe the person now has diabetes. I'm going to put a diabetes problem list in, and we have our diabetes toolbar show up. So this is kind of one example of how PS Suite can be customized for particular sites or particular users to give them, again, the quickest access to their frequently utilized tools for their visits. So part of your implementation or part of your training is kind of figuring out what toolbars you might need for your workflows and helping you populate these in your EMR. So again, when I remove diabetes, no longer a diabetic patient, that diabetes toolbar just disappears automatically. That's kind of one example of customization for within the record. Again, plenty more, and that's part of what will help you customize as you move forward through your implementation. Okay, so I think we have a good idea in terms of the screens we'll be using. So we'll be using, again, the appointment schedule. We'll be using the records window to kind of walk you through our mock encounter with Teresa. So I'm just going to refocus a little bit and kind of go back to some of the tools we'll be using with the demo. So the first one we're going to talk about is the TELUS EMR virtual visit. And again, going back to the main point, integrated into your current process. It's launched by the provider within PS Suite or using the mobile app. So there's no different portal to log into. There's no different applications to install. Everything is coming from within PS Suite. The other major point to recognize with EMR virtual visit is there's minimal technology requirements. So the patients, all they need is a mobile device or a computer with access to a camera or microphone and internet access. You don't need to download any applications, no registration process. We want to make it sure that the patients could still see their providers quickly and efficiently and not have to worry about technology barriers within, again, now that to see their provider. Another major point is multi-patient or multi-provider encounters. So sometimes you want to bring in a nurse or a social worker or a psychologist into your visit with you. We support, again, multi-provider as well as multi-patient. So if you want to see a husband and wife, if you want to have an interpreter or translator come to your visit with you, we also support multiple patient or multiple providers within this solution. So I'm going to get started. I'm going to show you how to conduct a virtual visit. So right from the appointment schedule, I see Teresa here at 11:45. I can right-click, and I can start the virtual visit right from this window. At the end of the demo, I'll show you how to do this workflow from the mobile app as well, so from your mobile device with a tablet or cell phone. So again, either or works. We can always one click away to start the virtual visit. This is going to open up into kind of the technology test. Before I do that, I did promise you I'm going to look at the what the patient receives, though. Sorry, I should have opened this first. There it is. Okay, so automatically, I'm just going to go back to my email address. So Teresa, as a patient, what she received is an automated email from PS Suite from a no reply, so they can't reply back to your clinic, that indicates kind of the time of the visit. Let me just reload that again, hold on. So it indicates kind of the time of the visit. This is one I just made for Alison Armstrong. It gives her brief instructions for how to access the visit. You can click here for complete instructions, which includes the best tips or the tips to get the most out of your virtual visit as well. So technology and kind of best practices for virtual encounters. We have last minute issues. We can test your connection now. We also give them a TELUS Health support line to call. So if they run into issues with their encounter or with their technology, they call TELUS as the first point of contact to help them troubleshoot their issues. So we want to make sure that you guys focus on seeing patients while we focus on the technology issues. So again, we give them enough chances or plenty of opportunities to troubleshoot any issues. When they want to attend the virtual visit, they simply click on this button. Again, they jump right into the visit without any applications, no registration process, simple as one click for the patient from their device. So PS Suite automatically sends these emails as soon as you click on that virtual visit icon in your schedule. There's no additional work for the provider or for the administrators in your site. So I'm just going to minimize this for a second. I'll leave that open. So here is, again, going back to kind of how we launched from PS Suite. I right-click, start the virtual visit, and I can jump right into this with a join virtual visit option. So here's Teresa waiting for me. So she's my first patient encounter. Again, I can do a simple split screen if I want to see her side by side with her visit, so I can always resize these windows again. I can open up her record right beside it, so I can see her chart. Make this a little bit smaller. So here's Teresa's chart as well. And here is my virtual visit. Let me just go back to here. So there is, again, Teresa and my chart open on the other side. Sorry, let me just open this up again. And so if I want to see, again, her chart at the same time, I can see her encounter notes. I can also see how she has, my doc is hiding, there it is. There she is. I can see her chart notes. I can see her current problems, see her medications, and I can even prompt her to send a chat option as well. So if I'm having issues hearing Teresa or want to send her a link to a specific YouTube video to watch or education sheet, I can write her a simple note, please see www.here. So this chat, again, is a way to communicate if you're having technology issues. Maybe she's not in a private location and she can't speak openly. She can also send me a message through the chat back to me. So I can see that she's typing. I'm going to give her a second. She's here with her daughter. So we need to be conscious of what questions we ask her or how she's responding. So again, our virtual visit Once we have a timer, we have the chat feature, we can change our different cameras. We'll be able to send pictures through the chat for the patient. If there's a picture of a skin rash she wants to submit to me, she can send that through the chat as well. So I can have that securely transmitted from the patient to me. So I'm just gonna, just for sake of making sure we can see Teresa's chart full screen, I'm gonna pretend that we're gonna end the visit. So we've had our counseling session, and the first thing I wanna do is send her a screening tool to complete after the visit, so she can respond accurately and without her daughter overhearing things. So I'm just going to end the visit for Teresa. I'm going to confirm. Let's focus on our PS Suite again. So this is where the first communication piece I'm going to focus on comes into play. So how you communicate with your patient. So when you're doing virtual care, you can't give them a piece of paper to fill out. You can't give them a tablet to fill out. So you want to make sure we have a way to communicate with our patient in a confidential and secure way. So we can complete e-forms, you can capture consent for visits, we have online booking, we can do appointment reminders. All of these tools can be integrated directly into PS Suite to have provider and patient communication. So I'm going to show you using an e-form, or have her complete an e-form for the counseling session we just had, so she can complete on her own time. So I'm going to email Teresa a form, and I can send her a message through here. I can attach an e-form, maybe because, again, she has depression, we want to send her a PHQ-9 form. I'm going to send her a PHQ-9. I'm going to send that directly to her email on file. So one click of the PS Suite, sent her a form, and what she'll receive is right directly in her email, she will get a message from PS Suite that says, Alison, your healthcare provider wants you to complete a secure questionnaire. And this is going to be, again, an outgoing email only. She cannot reply back to me, but her answers will automatically populate her record. So her birth date, I'm just going to complete this as Teresa. So again, this would be her completing this because she could not answer these questions. Her daughter was in the room, and I want to make sure that I get her PHQ-9 screening on file. So I'm just going to pick a couple of these as quick as I can. And when I press my next button, the patient gets notified that it's successfully been completed. They can close their browser. So now that she has that completed, if I look back at her record, automatically it's already uploaded into her chart with her PHQ-9 scores. So we know that I sent the question at 12:27. She uploaded these answers, again, directly back into PS Suite through an email sent to her, or through a link sent to her email. So a lot of our EMR tools will give you e-forms, will give you consent questionnaires, will give you maybe procedure consents, all through kind of one click of a button directly from their record. So the first, again, because we don't have the patients in the office, that's one of the first pieces of communication that we need to address to make sure we have a secure way and an easy way integrated into workflows to communicate with our patients. Okay, so I'm going to just show you, now we've kind of patient questionnaire or patient communication. I'm going to walk you through just one type of template PS Suite has that will help you complete your visits and automate your workflows for the actual or for the encounter. So we have a configurable encounters we can use that allow you to have, again, these are created by you or customized by you. We have a repository or a library that you can start with. You can always modify the template as we go along. So I'm going to say Teresa presented with her costs. I'm just going to quickly go through and enter some details. So 7 weeks. It's dry, it's non-productive, whatever we want to rate in the quality of cost. And I have yeses and nos. So I'm using this with my keyboard. I can click on with my mouse. I can skip the ones I don't want to comment on. So again, we get our negatives, our printed negatives, and also our positives. I can say the symptoms. I can have a free text field as well if I choose to. I can cut her past medical history. I'll skip past the other portions. I'll go quickly through these ones. And here's where PS Suite templates can really save you some time and increase your efficiency. So our assessment, if I think she has asthma, I can see that my asthma treatments are going to display for me. Whereas if I think she has pneumonia, I get my pneumonia treatments coming presented to me in this template. So there is a kind of an interaction to these smart forms that will, again, present you the best clinical guidance for what you think the assessment is. So whether it's inserting forms or diagrams, presenting you the best treatment options, we can always, again, get that information to us when we need it. I'm also going to order a CBC. I'm going to start salbutamol. I'm going to, again, have her present to the ER if she can't have difficulty breathing, and I'll actually incorporate my billing right into this template as well. So with these forms, I have my prescription, I have my investigations, I have my billing completed, and I'm going to summarize all my negatives and positives and make a PS Suite progress note when I press my finish button. So I'm going to press finish. And here's our bill book that we created. So again, that's going to be, I'm going to leave the salbutamol for a little bit later. We have, sorry, actually I'm going to go back to PrescribeIT first, or I'm going to go back to the PowerPoint, because I'm going to talk about salbutamol in a second. So here is the salbutamol prescription. So the second important part is we want to have my provider or pharmacist communication. So PrescribeIT, I'll talk about salbutamol in a second. It's the way that we can send prescriptions directly from your EMR, and it's complementary for our clients. So electronic prescribing. So you'll see that there's no change in workflow for a fax prescription, a printed prescription, or a prescriber prescription. Again, we want to make sure we embed that directly into your workflows. The renewals from pharmacists come directly back into PS Suite. So again, you can approve or deny right from your message window about the e-renewal prescription. We're bypassing the fax machine entirely, so we can reduce the prescription fraud of a printed prescription as well. And again, same time communicating, we have messaging with pharmacists as well, and the most important thing is you have dispense notifications. So when your patient does actually fill their prescription, we'll have that sent back to your EMR so you're aware of if they're actually getting their prescription filled and taking your medications as you have prescribed it. So let me go back into PS Suite for a second. I'm going to show you the rest of the content. So I'm going to minimize this, and let's go back to what we've selected. So let's talk about that encounter cost. So there is that progress note that was created based on that template. You can see that I have my asthma, my CBCs were ordered, my salbutamol was started, and all my presentation and my essentially my SOAP note is going to be right there for me. We also created a CBC lab rec automatically filled for us. I think you saw the bill book. So here's the bill book again. So we have our asthma with an intermediate assessment already populated. And finally, we'll talk about prescribe a little more when we have our salbutamol. So going back to the encounter, we have our notes done, our prescription completed, we have our lab rec completed, and we have the start of our prescription to be filled out. So salbutamol, I press my tab key. I have a prescription favorite as well for salbutamol, or I can use our FDB, our drug database, to select a different dose. And here is where the workflow for PrescribeIT or printing comes into play. So if I print it, it'll spit out a piece of paper for me with a barcode on it. That barcode can be taken to any pharmacy, and they can scan the barcode to pull down or to get the electronic prescription, again, and pull it directly from your EMR. So that paper is just a route in, or an avenue for the pharmacist to pull down the PrescribeIT information. If I know who I'm going to send it to, I know that Teresa uses the Kroll Pharmacy. When it's a PrescribeIT pharmacy, we highlight the e-sign and send for you. So if you don't know who it's going to be sent to, you can print it and supply it with a piece of paper. I can fax it if it's not a pharmacy on PrescribeIT yet, or I can e-sign and send directly from the EMR. So the workflow does not change based on where you're sending the prescription. We just have to kind of select the right pharmacy. So with PrescribeIT, let's talk about some of the benefits of PrescribeIT. So you saw the workflow didn't change. You saw it submitted directly to the pharmacy. What you don't see happening is we're sending across Teresa's demographic details. That means the pharmacist can press add Teresa to the database, and it reduces their input for their workflow as well. So if they get the most accurate data about Teresa, it's also sending over her allergies. So if she has an allergy to that I've documented in my profile, they get that information as well. If I had a drug interaction, so interaction checking, maybe there's a contraindication, they get the interactions that I, as a provider, have managed before sending the prescription off. The final thing they'll get is they'll get her vitals. So they'll get her weight, they'll get her most recent lab work, if she has lab work that's required for that specific prescription. So I know that a lot of pediatric doses are based on kilograms. We send that weight on file over to the pharmacist. They can also double check the weight-based dosing. So going back to PrescribeIT, again, key being no change in workflows. We get electronic prescribing, which means no workflow, and they get more data to help them with their medication safety. And again, it just saves you time communicating with the pharmacist. So those e-renewals come directly back to you. If there's any questions about dosing they want to clarify, again, they send you a message through your EMR that you can reply back to directly from PS Suite rather than through a fax. Okay. So we've discussed patient communication, we've discussed pharmacy communication. The last thing I want to discuss, again, that's really important for the virtual care is provider communication. So we have a tool called MedDialog that allows you to send discrete data from your EMR to other healthcare providers. So it's electronic messaging that, again, sends discrete data from system to system. So it works in a variety of different workflows. So maybe you want to send a specialist a clarification question. Maybe they started them on a new medication. You get a lab result back, want to know what they think about this lab result. You can send them a direct message through PS Suite to that specialist. Maybe you want to send an e-consult to a specialist as well. So you want to send a letter with some chart pieces. You can send that through MedDialog. Again, bypassing the fax machine and just sending better data and more discrete data in a way that the other providers can use to increase, again, their information they have about your patients. So just to show you what the, oops, sorry, go back. Show you what the PrescribeIT will look like, or sorry, MedDialog. What's going on with my thing right now? Let me go back to PS Suite. So MedDialog, I'll show you a referral workflow. That's probably the best, most utilized case for MedDialog. I'm going to start a letter, and I'm going to select a doctor. Again, doesn't matter whether they're a MedDialog doctor or a different provider. We have our address, and we want to send a referral letter. So another type of PS Suite template is a stamp. I can select my stamp, and it will automatically pull in things like their address, pull in things like their medications, their allergies, medical problems. So we can populate things from their record to make sure our letter writing is efficient. Let's show you what it looks like in letter format. So we have our letterhead, we have my signature at the very end. I can always add notes and free text something in. So maybe she has that cough and we're wondering about what a respirologist might think. We can send more information through the letter. So if I want to send attachments to this letter, maybe I want to send across my notes. I can quickly green bar that note, and that will be included in my letter format, or my letter I'm being submitting. So this is key, this little kind of header right here. This is what we're trying to accomplish with integrated workflows. So send via MedDialog or fax. As I mentioned, doesn't matter if they are on MedDialog or not. We have the exact same workflow for providers. So it is a bundled service. So for you, when you adopt MedDialog, you just simply press send, and it will deliver it in the means by fax or by MedDialog, based on how the receiver receives their documentation. So if I do this, I open up our message sending window. This is a MedDialog message, and it's also an internal PS Suite message to an external person. So I have a consultation request, I have my chart items attached. I can simply press send message, and it's going to be delivered to Charlie Doctor electronically. Same thing with your fax machine. If you have multiple people who are receiving this message, some of them are MedDialog, some of them are on fax. Well, when you press send message, it will send, again, that discrete data by MedDialog to the MedDialog receivers and by fax to the fax receivers as well. So there's no change in kind of the workflow based on how the receiver will accept their documentation. So again, the benefits of MedDialog being no change into your workflows. You get better, more usable data going across to the particular providers you're sending it to. And it's going to, again, increase their workflow as well. So it's going to quickly show you what it looks like when you receive a MedDialog message. So this is a new patient that I don't have in my system, so this is our message window. And when you have a MedDialog message received, this is a kind of a workflow you'll have. So send over, again, discrete data for their names, their birth date. If we do not have this patient in our system, we can add them directly as a new patient with one click. So if you're in a specialist clinic and you get a referral from a general practitioner or a nurse practitioner, you can add that referral as a new patient very quickly, and it just pops up with their details such as their name, their sex, their address, their phone numbers. Everything will be completed for you through MedDialog. So that discrete data going back and forth just means more accurate data and more efficient workflows for both kind of senders and receivers. Okay, let me just close with that. And let me just kind of revisit what we've kind of discussed before. So we had patient communication, which was what we had Teresa complete with the PHQ-9. We had our PrescribeIT communication, which is provider to pharmacist, which is how you can send discrete data like allergies, vitals, your prescriptions directly to the pharmacies. And finally, we had MedDialog, which will show you provider to provider communications. Again, that discrete data going back and forth to make it more accurate and more efficient workflows. Okay, the last thing in terms of the virtual world I want to show you is I've been spending the majority of time in PS Suite. So this view that we have right here, this is the desktop view. So what you also get is when you're outside of your clinic or when you're working remotely, which we're doing quite often now, we also have a complimentary mobile app. So I'm going to show you the mobile app based or kind of from our PS Suite window. So it'll look like this on your tablet, on your phones, or even on your desktop EMR. So kind of here's what you'll see through the mobile app. We can see our home screen, which will allow me to see my daily schedule. I can see my calendar for any day that I want. What I'm doing tomorrow, I can click on tomorrow's date to see my schedule. I can look up particular patients as well. So if I want to see Teresa's record, again, when I'm at home doing a virtual visit, I can pull up her encounter directly from here and see that progress note we just made today about her cough. So it's kind of like two records in one. So it's the same record across the mobile EMR as well as the PS Suite EMR, and they work side by side and automatically updates both records. I can also see my address book. I can also see my inbox, so my labs that have come in. I can see my messages that my administrators are sending me. I can see all of that information directly from my cell phone. Let's go back to Teresa's record for a second, just to show you more things about the chart. So I'm seeing her entries into the record, so her letters, her lab recs, her labs, her notes. We can also see her medical summary as well. So again, if I want to see her problem list, her current medications, I can also pull that up directly with my cell phone or my tablet. One of the, again, going back to how we're changing our delivery, this virtual visit, virtual care, sometimes it means you need to have a different, you don't have your computer with you. You want to start the virtual visit directly from your phone. Again, it's one click of a button to open up from your cell phone and start that virtual encounter with Teresa as well. So as I mentioned, start directly from PS Suite as well as directly from your mobile device. Okay, so I think based on kind of what I've been showing you, I think the highlights of what I want to point out is that all of the things have been integrated directly into PS Suite workflows. I think you heard me say there's no change to workflows, how you're sending or receiving information. We want to make sure that, again, it fits and mimics your existing workflows to make sure that virtual care is integrated directly into PS Suite as our providers are already using it. So I'm just going to actually pass it over to Teresa for a second, because what she's going to walk you through now is the implementation process for how we support you as you onboard onto PS Suite.
Thanks, Alison. So as a new client, once your order is received by our implementation team, we start the process by reviewing the details of your order through our intake point, and we will scope and evaluate all the details that were discussed at the time of sale. We will assign the project to one of our project managers who will reach out to you, as they'll be your point of contact through the entire cycle. They will begin the project kickoff process. They will assemble the TELUS EMR team. Along with the PM, the project team will include a learning specialist, a clinical data analyst, and our professional service engineer, who is the server configuration expert. All of these team members will work with you through the implementation from the start and through to go live. We will adjust your project needs, of course, based on your circumstance. For example, if you have a paper-based system today versus a full electronic data migration requirement. Our team will arrange for a clinic needs assessment with one of our learning specialists who will work with you to understand the unique workflows of your practice and to guide you in the development of customizing your training program. Our data team will evaluate the data size and mapping requirements aligned with the migration activities. And you and your team will be supported with opportunities to review that clinical data in a test environment prior to the live migration. Throughout the entire implementation process, we'll focus on the EMR delivery with minimal downtime to ensure you are able to see and take care of your patients as quickly as possible. We'll make sure and help you and support you in the first few days of post-go live to ensure your team's success in the clinic workflows, while helping also to remove those first day jitters of a new system. As you use the system in the first few weeks of go live, our PM will continue to be the point of contact and will help you transition in the next level of client support when you need it. They'll introduce you to the processes in connecting with your client experience organization. Our implementation is complete, and you'll be successfully utilizing PS Suite EMR within your practice and with your team. I think that's it from an implementation view. We would like to wish everyone a wonderful afternoon, and we'll connect with you soon. Make sure to also check out other upcoming webinars on the registration page, and thank you again for your attendance.
Ladies and gentlemen, this concludes the Navigating the New Realities of Care Delivery with the TELUS PS Suite webinar. Thank you very much for your participation, and have a nice day.